I started seeing more providers. I remember going to Chicago to see a certain doctor who specialized in feet and ankles, and no one was really able to give me a definitive diagnosis. I started working with Dr. Strax. That really helped me have someone to come to each week and just say, can I keep exercising? Is this okay? Hearing other people's experiences. And through that process, my pain went away. I had some hiccups that came a little bit later, but my pain did resolve.
Welcome to The Story Behind the Symptoms, a podcast from Symptomatic.me. Your host is David Clark, MD, a board-certified gastroenterologist who successfully diagnosed and treated over 7,000 patients with neuroplastic pain or illness. Each episode, we dive into our guests' life experiences to uncover the deeper causes of their symptoms. By listening to their story, you will gain insights that advance your own journey towards knowledge that becomes healing.
Hello, and welcome to the Story Behind the Symptoms podcast. I am your host, Dr. David Clark, and in this podcast, we talk to people who have suffered neuroplastic symptoms and try to understand where they came from and how they recovered. And my guest today is Sarah, and would you please introduce yourself?
Sure. Thanks. My name's Sarah Poltorek. I've experienced neuroplastic symptoms at a couple different points in my life. I'm also an occupational therapist and currently a clinical associate professor of OT at UW-Madison, where I teach students about neuroplastic symptoms as well as a whole bunch of other things. So I'm happy to be here to share my story.
Yeah, it's so wonderful that you are teaching these concepts to your students. Occupational therapy is one that these ideas impact tremendously. And I'm guessing that when you were a student, I believe in your same program where you're teaching now, that they didn't cover this.
No, absolutely not. I remember there being a diagram about pain that did include the mind, that it was just like a very simple kind of written and drawn out visual of the factors, but there was no clear discussion of exactly how or exactly what that means for intervention. I kind of stumbled upon it myself and then felt like people need to know this. So.
Yeah, absolutely. And it's such a great thing that we're hearing about more and more health professional training programs that are including this. I've been teaching this at the medical school in my community for several years now, teaching it to physician assistants for several decades now. So it's great to see it growing the way it has been. But our focus today is on your personal symptoms. And this is not exactly like what I used to do in my office, but definitely in my office, I would like to start at the beginning when the symptoms first came on and what they were and their progress over time.
They started actually when I was in the OT program as a grad student. This was now 2012, so 13 years ago. I, at the time, had been training for marathons quite intensely and had just started graduate school. And I remember completing a race, and right afterward, I started having this ankle pain that sort of seemed to come out of nowhere. It was like on the side of my ankle. At the time, I knew nothing about the tools that this work have provided. And so I did the classic thing of going practitioner to practitioner to figure out what was going on with my ankle. I also was certainly very, very scared because running was really a huge part of my identity. So I was really worried about losing that. And I remember wearing an ankle brace, going to an athletic trainer, going to a PT, and having started graduate school, feeling like I got to figure out what this is. I really want to fix this. Maybe this profession, in addition to the other reasons I went into it, maybe it would give me some answers. I remember that it started in the ankle, and then after a while, it moved up to my left hip and my low back. And that's where I would say the symptoms stayed for quite some time. At some point in that it was really intense. Most of the time I stopped running. It didn't prevent me from doing my daily activities, although I did get a lot of pain if I sat for a long time. But the pain was in my ankle for a few months, maybe a little longer. I stopped running. I started seeing more providers. I remember going to Chicago to see a certain doctor who specialized in feet and ankles then, and no one was really able to give me a definitive diagnosis. That doctor said that my cuboid bone was subluxed, and he kind of like popped it back into place, but that didn't really resolve things. And so then the pain moved up to my hip, my left hip. Kind of felt like deep inside the joint, and it was also in my low back, and it stayed there for quite some time. So I tried to do a lot of glute strengthening. I was seeing a PT. Then I started doing kind of the classic bounce around from practitioner to practitioner. I saw a chiropractor. I saw a massage therapist. I saw a craniosacral therapist, neurovascular therapist.
Okay, I don't usually interrupt people when they're telling me their story when they're in my office, but for purposes of the podcast, I can't help but ask whether the pain in the ankle went away after it moved to your hip.
Sure. Yeah, it did. It did. Because then for a long time, the main complaint was just hip flow back.
Okay, but that's very typical, as you now know, for a neuroplastic symptom for it to move from place to place. Whereas structural damage to your ankle is not going to move to cause pain in your hip. So that's a big red flag for this being neuroplastic. But I'm guessing that none of the practitioners that you went to see had any idea why your pain should behave like that.
I feel like the narrative then, and possibly even still now, is that if you injure one part of your body, the rest of your body is adapting to maybe how you're walking differently, or you're losing strength because you're not doing the activities you used to do, or you have this muscular imbalance. And I still find that I come up against this as a practitioner and as a teacher, that people are convinced that if your pain moves, it's because now you've disrupted this chain of muscles or this chain of joints. And I don't know if it's appropriate to ask you a question, but I'm curious how you maybe debunk that or talk to people who maybe think that that's always what's going on when there's moving pain.
Yeah, there's no evidence that any of that is happening, and yet it's a common response for somebody that was trained that all pain and illness is linked to organ disease or structural damage. And if you have that training and that belief that it's all organs and structures, then you have to find a narrative that will account for why somebody's pain might have behaved like that, that fits your training and your understanding and your beliefs. When the old expression, when your only tool is a hammer, every problem looks like a nail. So you have to make it somehow be explained by a structural abnormality, even when there's no evidence for it at all. But once you become aware that the brain can cause symptoms anywhere in the body of almost any level of severity for almost any duration. One of my patients was ill for 79 years. And then you have this whole other area of explanation that you can apply to your patients. And suddenly a whole lot of conditions that previously were complete mysteries to you become conditions that you can diagnose and treat successfully. Physicians in particular that I've trained absolutely love it. I mean, people that used to make them beat their heads against the wall, now they can successfully diagnose and treat them, and people get better. They get better at least as often as people with the traditional medical and structural conditions that we're used to seeing. So once people accept that there's a third category beyond organs and structures that can cause real symptoms, it's absolutely transformative. All right, I just want to also emphasize that when I'm talking to someone about their condition for the first time, I try really hard to just shut up and listen and let them tell their whole story. Because if you interrupt people, they'll usually shut down and they won't tell you all the stuff that can be relevant. But, for the purposes of the podcast, I make it a little more of a dialogue. But for the clinicians out there who are watching this, shut up and listen.
To be fair, I asked you a question.
Yeah, well, I interrupted you first, but okay, let's go on. You've got the hip pain. You're going from clinician to clinician. Then what happens?
Going clinician to clinician, nothing's making it better. Maybe sometimes I would have the experience of I do some PT exercises for a week or two, and I think maybe it's a little bit better, but I'm still really scared of running and convinced that until the pain goes away, I can't run because that's clearly what caused it. I then went to a sports medicine doctor who did an MRI with contrast, who was this was the first time I had imaging of the hip itself. And she diagnosed, I was like 24 24, maybe 23. So she diagnosed me with a left labral tear of my hip, as well as bursitis of the hip, as well as osteoarthritis of the sacroiliac joint. And I just remember being in her office thinking, I have arthritis. I'm in my 20s, just terrified. And she named those three things and then said, so which problem would you like to address? And I was like, you tell me, me. I mean, this was so scary to hear. Here I am thinking I just have a little bit of structural imbalance or muscular imbalance and a little bit of hip pain. And now I get these three diagnoses that were all really quite scary to me. And I feel like at this point I had done what you would consider the conservative approach. I've seen a lot of providers who give exercises or who give massages or do body work and all of that stuff. So at this point, she recommended surgery of my left hip to repair the labrum, which I actually did undergo around, a couple months after she had recommended that. So by the time I got to this point, I had already been in pain for like 5 or 6 years. Kind of had been going, mostly just lived in my hip for a long time. And I had been bouncing around until I finally got this diagnosis and did undergo surgery, which afterward, I think I did have the classic, like, okay, at least I feel like we fixed the structural thing that came up but my pain didn't go away. So then I saw PT for that, like post-op classic physical therapy to just regain strength. And that all went fine, but I still had that same pain. And of course, my mind is thinking, well, this is probably just post-op pain. I'm not strong enough yet. It'll eventually go away. And it didn't.
Yeah, I can just report that somewhere there was a study of images of the hips of asymptomatic ice hockey players, I believe it was, and lots of them had labral tears. And again, they had no symptoms.
Yeah. And I even remember someone, maybe it was the surgeon, someone saying, well, most people who have one hip with a labral tear also have one on the other side. And I remember my mind already being like, oh gosh, I probably am going to have to do another surgery in the future. Growing up, I was a dancer and a competitive cheerleader. And so the narrative I built was, well, I must have overstretched at some point or injured it doing that type of exercise as a young person. And now I have one hip that clearly is, needed intervention, and I'm going to have another one down the road. And I was already bracing for that at that point in time.
Very depressing to hear in your 20s, because you're only imagining, if I'm this bad in my 20s, what's going to happen later.
Absolutely. I remember even I had started working as an OT in the hospital a little bit around that time. And I remember talking to patients or talking to even people I would meet through friends or family who were older than me, like later adulthood. And they would say, you have chronic pain. You're in your 20s. You're not supposed to have pain. And I know that was good intentioned, but the way that landed for me was like, there's something uniquely wrong with me, right? Like I did something, or I have some sort of body that is broken and not fixable.
Are a damaged human being.
Right. Absolutely. Yeah, that was certainly the feeling too when I stopped running was, well, the rest of the running community gets to keep training for intense races and marathons, and I have to sit out. I have to sit on the sidelines. And even though I've been doing that for years, it's not getting better.
Yeah,
it's
and
frustrating.
It's not only a form of recreation, but it's a chunk of your identity.
Absolutely. Yeah.
Okay. Can we have some good news now?
Yeah.
When did things start to turn around?
Some great news. So after the surgery, like I said, I had gone through PT. I still had pain. I was on vacation with my husband at some little cabin place up in northern Wisconsin. And in the lobby, they had a bookshelf. And I happened to pull a book off the bookshelf that was a book called This Naked Mind by Annie Grace. And it's about alcohol and sobriety. But in the preface, or in the first chapter, she talks about how she had chronic pain and how she read Dr. Sarno's book and how after reading the book, her pain was gone. And I was like, gee, that's interesting. And so then I didn't read her book, but I went and got his book and I read it and had that kind of moment. And like, okay, maybe this makes so much sense. I fit these personality characteristics. I fit the bill of hypervigilance and checking in on my body constantly and ruminating on this all the time and desperately wanting to fix it. So at that point, I Googled, I think there were fewer internet resources compared to what there are now. But I eventually came to the TMS Wikipedia page and found the Curable app. And so I started listening to the podcasts, actually, is really where I started, which really helped me hear story after story of people who have gotten better, story after story of practitioners or researchers who have found this to be effective with their patients, and just sharing more about the neuroscience behind why it works and how it works. And so I was listening to podcasts constantly, pretty much, to try to, really get myself to buy in. And then I started being like, okay, maybe I'm going to try to go for a run. I would go for a run and I would listen to a podcast at the same time, and, not super far, but just trying to kind of like get a little bit of a corrective experience. I started working with Dr. Strax via Skype, or, I don't remember the exact platform, but telehealth or virtually, just doing group therapy, where that really helped me have someone to come to each week and just say, can I keep exercising? Is this okay? Hearing other people's experiences. And through that process, my pain went away. I had some hiccups that came a little bit later, but my pain did resolve.
Yeah, that's it's remarkable how quickly things can transform. Can you recall, out of the many ideas you must have encountered at that time, were there any that stood out for you in particular that were especially valuable?
Mm-hmm. I remember in my journey prior to discovering these tools, coming across this idea that stress can increase pain. Sometimes our bodies hold on to our emotions for us. That wasn't new to me. But when I had first heard those things in other contexts, I then thought, well, I need to manage my stress better. I need to be perfectly stress-free. I need to always be mindful. I really thought, okay, if I just do that, my body will heal what must be a structural issue. And so when I discovered these tools, the aha was the structures are actually fine. And yes, I can use some of those relaxation tools or mindfulness tools to just decrease the alert in my brain. But even if my brain's on high alert, the structures are fine. And to me, that was just such a key thing that, of course, is counterintuitive and hard to believe, but that differed a lot from some of those other ways of presenting some of the same tools, if that makes sense.
And was there a particular tool or change in the way you were living your life that seemed to make a particularly big difference for you?
Well, I also have a memory of when I was in pain, I discovered Kristen Neff's book on self-compassion, and I read that book, and I had like one whole day pain-free because I was like kind of just exploring being gentler with myself. And so when I discovered Curable and started working with Dr. Strax, I also got Dr. Schubiner's book on Learn Your Pain. I mean, like, I got all the things, and all of those were super, super instrumental. But I think this ongoing practice of just trying to be a little bit more gentle was super important for me. As far as like the way I lived my life, I mentioned when the pain came on, I was training for marathons, starting graduate school. I was in a relationship at that time that was another person who was intense like that. We were trained for races together. There were other factors about that relationship that were just not healthy at all. And so I remember I left that relationship, and this was right when I graduated from graduate school. And I thought, okay, I got rid of the stressor. My pain should go away, right? Like I'm managing my stress. I'm shifting, but I still thought there was something that needed to be structurally fixed. And so when I discovered these tools and started trying to practice a little bit of self-compassion, I also met my now husband. And so I think just building a life together with a little bit less of that intensity, it's an ongoing practice, right? To kind of not bring such intensity, but that was something that I think really helped.
Yeah, there's a lot to unpack in what you just described that is highly relevant to the generation of neuroplastic symptoms. Maybe this would be a good time to look at experiences you had as a kid that might have brought you to a place of intense effort and achievement and accomplishment. I mean, graduate school requires a lot of intense effort. Training for a marathon obviously requires a lot of intense effort. Doing both of those at the same time would strike some people as even more over the top. And when a person's intensity has, no upper bound to it, when there's no sort of natural limit or internal safety net that tells you when to ease up, then a person's mind can drive them to levels that never stop until the body forces you to stop. The mind kind of creates the symptoms as a way of saying, we need you to stop, and we're going to force you, is kind of the way it works. I find that it helps my patients make the changes they need to make if they can understand where the roots of that intensity come from. Can you think of anything when you were growing up, for example, that you wouldn't want for your own children, that happened to you that could have contributed to that level of intensity?
Yeah, I can't think of anything that I wouldn't want to happen to my own children. I had a very loving and supportive home. However, I've thought about this a lot. So my mom was married before she married my father, and she had two sons who were my half brothers. And then she got divorced, married my dad, and then had me. And so I am 10 years younger than my siblings and was kind of like an only child, because by the time I really have any memories, they were teenagers and sometimes at their dad's and halfway out of the house. And so I'm the youngest. I'm an only child. I remember I have had a natural aptitude as a young child for kind of academic skills. Like I learned to read really young. I skipped second grade. I kind of have just like naturally had some aptitude in those areas of learning skills as a child. It has, the playing field is much evened out as I've grown. But I just remember I get curious about being praised and rewarded for getting an A, for doing a good job, if that at all played into the feeling of like, that's what I have to continue doing or else. My parents never put pressure on me in the way that maybe some parents do, as far as, you have to succeed. But I remember I always had everything I needed, but my mom always has worried about money. And so I remembered her saying when I was a kid and, you think about what you want to be when you grow up, I remember her saying, like, you just don't want to have to worry. And I remember as a child worrying about money for her because she would sometimes tell me that she was worried about money. And so just this like baseline level of a little bit of insecurity, I think, was always present. I was in daycare at a young age and was watched by my aunt and uncle at a young age. And the way that especially my uncle, the way he raised his kids was a lot of, I had two cousins who were close in age and they fought like siblings fight. And there was a lot of threats of like, blah, 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 or you're grounded, right? A lot of this kind of a little more harsh in the way that they parented, in which my parents didn't. And I didn't really have a sibling. I mean, there was just less conflict. And so I sometimes wonder about the impact of that as other caregivers in my life. But I also think that I had it was difficult. It felt difficult for me to be at daycare or to be watched by other people. I remember really worrying about something bad happening to my parents while I was not with them. And I remember my mom losing her mom her mom passed away when I was pretty young, but I remember coming home and my mom was just crying and kind of feeling like that was totally unexpected. Like all of a sudden someone could be gone. So I think just a mixture of those things. I was probably primed. I'm a sensitive person, so there's maybe that. And then I know that my mom is someone who tends toward fear. And that was certainly palpable. My parents were very loving to me, but I kind of get curious about, the fear being kind of modeled as like, oh, there's something bad might happen, whether it's money or loss of a loved one. And then a lot of time spent, at a daycare or with someone else watching me that felt very unsafe.
Yeah, and a child in an environment like that doesn't have that many options for how to cope with it. And one of the ways that children who grow up to become my patients cope with it is they focus on the needs of the people in the household. They want to do whatever they can to reduce the problems in the household, whatever they are, whether it's fear about money or fear about sudden death, somebody being taken away, fear about problems happening when you are in daycare and wondering about, how your parents doing. You are ending up focusing not on yourself as a kid, which I'm sure your own kids do all day long, is they just play, which is, how we learn. to understand and meet our own needs. But if you're in an environment where you don't quite get to do that at an ideal level, it can definitely push a child into being the best little kid they can be, accomplishing as much as they possibly can, constantly thinking about and what the needs of others in the household might be, rather than learning about what you need for your own joy, satisfaction, contentment. And that can definitely generate a level of intensity that becomes a part of who you are. It just, you learn as a kid that this is what you need to do, take care of the needs of others, help them out and be really accomplished, do so well in school that you skip second grade, become a, really competitive cheerleader, become not just a middle distance runner, but a long distance runner, and do the long distance running while you're doing graduate school at the same time. And I have to add also that people who grow up acquiring that mindset, they often find themselves in their early close personal relationships with people who have, let's just say, more needs than average, and that they are in relationships where they are giving to the other person more than they are getting back. And I don't know if that was an issue with the person you were in a relationship with at the time your symptoms began, but it certainly is very common in my patients. And part of the healing process is absolutely self-compassion, which you mentioned as one of the important concepts. Absolutely is that you are able to recognize that you're actually a pretty decent human being, and that you might well have gone through more challenges as a kid than you appreciated at first. And that the more compassion you can give to yourself, the more you can recognize how much you had to overcome as a kid and give yourself credit for that. That internal shift in self-image enables people to have their next close personal relationship be with somebody that appreciates them just as much. In other words, the more you appreciate yourself, the more you will insist on only being with somebody who also appreciates you. And that leads to much more balanced relationships. Does that sound like a reasonable interpretation? Because if it doesn't, that's fine too.
Oh, it absolutely does. Yeah, I think that in addition to all those things, it's like when you develop kind of those perfectionistic tendencies or high achieving tendencies historically in school and in sports, you're praised for that. Growing up, it's like, that's good job. You're encouraged. You're one of the good kids. You're stifling your feelings so that you can be easy and be convenient and not rock the boat. And then you do well. And it's so when underneath all of that, there's this struggle that took me a while to even become aware of, because it was like, well, isn't this what we're trained to do? It kind of feels like the way school was when I was growing up. It's like, you don't want to be one of the quote naughty kids, right? It's like, you don't want to get in trouble. And so, yeah, it's hard to even question it yourself until you have something like pain or like some unexplained symptom to kind of direct your attention to some of the things going on beneath the surface.
Yeah, absolutely right. And you mentioned something else that's very important, which is stifling feelings. Many of my patients, for any of a variety of reasons, felt that they needed to do that as kids, especially obviously the negative ones. Nobody worries about stifling happiness, but stifling the negative ones detaches a person from a really important source of feedback about the world and their place in it. If you are having anger, fear, shame, grief, guilt, but you're not consciously aware of them, then you are missing really important signals about how the world is affecting you. And I have had patients where that alone led to all kinds of ripple effects and problems that, they made poor choices for themselves in relationships, in careers, and were still having those emotions, but because they weren't consciously aware, all they got was the physical manifestations. Emotions always come with a physical manifestation, but if you're not consciously aware that the emotion is there, then all you get is the physical manifestation. And that causes you to worry about what in the world is wrong with my body, which causes fear, which causes more symptoms. And you get into a vicious cycle, all starting with the idea that an emotion happened to you and you didn't know it. Were there particular reasons that you can recall, and you may not, but why you had to stifle emotions?
I remember being, well, from a young age, I wanted to do it right. I often wanted to get it right, or I wanted to excel, or, figure out how to make my drawing look just so, or whatever toy I was playing with. I have many memories of getting really frustrated and my dad saying, "There's no need to get frustrated," and kind of like laughing. And I know he has good intentions and means like, this is fixable, right? This is not a huge problem. And my dad's a really easygoing, kind of like go with the flow kind of guy. But I think I interpreted that sometimes as like, oh, my emotion is wrong and it's even laughable. And so I have that memory. And then I remember in my house when my parents were, in disagreement, which was not often, but if there was some sort of, sometimes my mom would be really stressed and she's got a lot on her plate and it kind of would turn into this she would clean really intensely and she'd be really quiet. And it was like kind of this, like, something's the matter, but you're not saying it and you're expecting us to intuit it, and no judgment for the fact that that was what happened. But there's a little bit of like walking on eggshells feeling, okay, I better try to not make her more upset, or there was not a lot of necessarily like display of healthy communication about negative emotion or having a negative emotion. It kind of would like stew in this passive aggressive kind of a thing. I think my dad was similar. It wasn't only my mom. Like he would kind of do a similar thing. And so as a kid, sometimes you can feel the tension in the house and it's just a little bit like, okay, especially for a kid who's really driven to, keep everything happy and do things right and make sure nothing bad happens. I just don't think it was part of the culture either at school. I don't remember really any talk of feelings in my classes, which I think is now more embedded in school settings. Yeah, there was a little bit more of the culture of like get up and just do it. Um,
Yeah, and that's so enormously difficult for a child because it goes beyond just those moments of walking on eggshells, because you would have been aware that those moments could happen at any time. And as a kid, you were very likely controlling your emotions all the time to try to minimize the number of those episodes of mom and dad going into their shells. It's some of my patients, and this may not have been true for you, but for some patients, the environment is resembling a minefield where some days everything is fine, other days everything is not fine, but you have to be vigilant all the time, control your emotions all the time, be on your best behavior all the time, be extremely self critical when you fall short all the time, because uh, you want to keep those mind explosions to a minimum. So it ends up that you're not having an issue just at those bad moments, but having to be constantly vigilant and constantly achieving. That's another way that children try to improve things in their household, is by being really good little kids, making those drawings as close to perfect as possible and being a lot more critical when your drawing isn't good enough than you would be of another child whose drawing wasn't good enough. All right, let's come up to the present day. Have you been completely symptom free, or do they sometimes crop up?
Yeah, they sometimes crop up. So when I first recovered, I was like ecstatic, amazed at the power of the brain. Obviously, so excited at my newfound freedom to return to things that I love. And I started training for a half marathon kind of right away, or pretty shortly after. And at that point, I got like an actual physical injury. I got a stress fracture in my shin on one side, which recovered quickly with the protocol and no follow-up issues. But then the day of the race, of the half marathon, I started feeling a little bit of right hip pain on the other side. And I completed the race, but kind of like limped that last mile. And I was in a ton of pain, went to the doctor, sports med, did an MRI, nothing. They were like, you may be in your hip flexor. It kind of sounded like they were trying to give me something.
We gotta fit it into that physical box.
Right. Yeah, absolutely. So I was on crutches for a couple of weeks because I like putting any weight on it was really, really painful. Maybe a week or two. Yeah, it was really stressful and scary. I did the physical therapy, which I couldn't tell if was, because there was no definitive diagnosis, I was kind of half in, half out anyway, I would say, with the exercises. Returned to using some of the strategies that had worked for me the first time. I didn't work with any providers directly as far as a mind-body practitioner or someone who was trained in this approach, but I did return to listening to podcasts, using the Curable app, and eventually it resolved. And I guess I got curious a little bit about that time. Like, was I just putting a ton of pressure on myself and going right back to where I was before the pain had come on? The day of making it about a race and kind of returning to that competition. And that has been a confusing piece for me all along, I will say, is like, where is my limit? Is there a limit? Is it about how I'm going about it versus is it about what I'm doing? How do I kind of figure out where my limits are? Or is there something that needs to be explored further as far as my attitude toward myself when I'm going about those things?
Yeah, I often tell my patients that when their symptoms are flaring up, that it is a communication from the mind. The mind is using the symptoms as a form of language to try to let you know that it is in a state of distress about something. And it can be challenging sometimes to uncover exactly what it is. One of the issues we haven't discussed yet that is common is that my patients are challenged to take time for their own joy. They are the kinds of people that take care of everybody else, just as you did when you were a kid. Take care of the husband, the children, people at work, the neighbors, social organizations. But when it comes to putting yourself on the list of people you take care of, having time for activities that have no purpose but their own joy. Running, some people get a lot of joy from running, no question. But it is also especially for something as long as a half marathon or more, it's very goal oriented. And for some people, it's more about the goal than it is about the joy. And it turns out that taking time for activity with no purpose but joy, just like your kids do all day long, that is an essential human skill. And many of my patients don't totally have it. You ask them, what do you do for joy? For this, just purely for yourself. And people have trouble coming up with things, or they tell me something that they do for joy, but it turns out that it's rather goal oriented. I can't tell just from talking to people. I don't have a blood test for how much of a particular activity is for the goal and how much is for the fun. But if it's more for the goal than it is for the fun, that's when the symptoms crop up.
Yeah, absolutely. That resonates. I'm also a dancer, so I perform Brazilian dance locally in town. And that's something that has absolutely been a huge source of joy as an adult, because when I graduated from high school, I danced and did cheerleading growing up, but it kind of felt like, well, that's the end of the line for these types of things. And that was fine. I was ready to move on. But when I found this as an adult, it has been a really sweet way to continue dancing and do it in a community. And the energy of our group is a lot more joyful, I would say, than goal oriented. But there are opportunities for, more learning, and we've brought in teachers from Brazil and from other places. And so I certainly noticed myself getting back into kind of that, competitive mindset when that happens. And in fact, just last fall, so a year ago, we had brought in some teachers and I was doing a dance class, and there was one moment where I was like, ooh, my right hip I must have moved wrong, right? I kind of like had this feeling of pain. And it was in a slightly different spot than the half marathon spot on that same hip. And that has kind of fluctuated, but stuck around to some extent over the past year. And I remember at that class feeling like we've got these guest teachers. I've got to do my best. I've got to do exactly what they say, right? Just kind of getting a little bit back into that place of the stakes are high, right? I have to perform. It has to look just so. And it has been, this past year on and off. I notice it increase when I have more stress in my life, whether it's from dance or dance plus work or dance plus work plus kids. And I notice it completely go away or nearly go away when I have a little bit more balance or when my attitude toward what I'm doing is less full of pressure.
Yeah, the neurological railroad tracks that are laid down when you're a kid, they're very strong. Especially when they've gone on for years as a kid. And it's very easy for the mind to go right back into those neurological circuits as an adult. And the symptoms are the mind's way of kind of raising its little hand and saying, we are in a state of distress here. And we want you to go in the direction of joy and self-compassion. And I think if you use the symptoms as your signpost for that, you reach a state of what many of my patients have reached, which is actually gratitude for their symptoms as a special power that the person has for insight into themselves and their lives that people who don't have those symptoms, they're lacking in that. So you can use it as a form of insight, a unique channel that you have with what's happening in your mind.
Yeah, I love that framing of it. That helps so much because, of course, our natural reaction, right, is to hate it or to be frustrated by it
or afraid of it.
Yeah, all of the above, and really want it to go away. But I remember the first time I recovered from pain, it was 7 years that I was in chronic pain the first time. Well, the only time I would say that it was that intense and that debilitating. And when I recovered, I just remember feeling so empowered and proud and so grateful and knowing that I preferred to have had the pain and had that whole 7-year experience as opposed to never having had an experience like that. I often say it's second only to childbirth in my life thus far as like most empowering experiences. It's pretty hard to top childbirth, but it's like really something that has made me who I am and made me just incredibly impressed by our brains. It's so amazing to see that what once felt inescapable and like the only way our brains can operate be completely changed into a different thing is just so cool.
Yeah, it is an aspect of my career. I never had these symptoms myself, but the intensity levels that some of my patients have reached is just extraordinary. And it's actually kind of embarrassing as a physician that I went through nearly all of my formal training without anybody ever mentioning that this was possible, that someday I was going to see a woman with 79 years of pain from this, or a teenager in the hospital for 70 days when I was asked to see her getting morphine around the clock for unexplained abdominal pain. Another patient with a completely paralyzed stomach, not the abdomen, but the organ of digestion was completely paralyzed in his case. And all three of those patients successfully overcame their conditions by uncovering the sources of stress. It's just stunning. And again, the fact that I wasn't formally taught this during my education is just a gigantic blind spot that fortunately you're now helping to fill at the University of Wisconsin. So I'm really grateful to hear that. And I know that now that you understand where these symptoms are coming from, you're going to be able to use them as a signal, and that the railroad tracks of your neurologic system that were developed when you were a kid are going to get progressively weaker over time and not be able to influence things as they have. Well, this has been so insightful. I'm very grateful that you have shared this story and that you are teaching this to your students. Going to be the way of things in all professional health education, whether it's mental or medical or occupational or physical, for the rest of the century. Is there anything else that you would like to share, or any questions that you have for me?
I have a question on that topic about it making its way into education, or even those examples you gave of people who have symptoms who seem really intense and scary. I sometimes find it hard myself now to not just think everything's neuroplastic. And I have certainly very familiar with the questionnaire of kind of how we can show the higher likelihood if people have a lot of stress or fit the personality traits or haven't been able to find anything wrong. But are there any certain conditions that that you think are more commonly diagnosed as structural when they're really neuroplastic? I ask this because I teach a class on like orthopedic conditions. And this year I taught chronic pain and neuroplastic, this approach at the end. And then my students were like, so did everything you taught us before that, was that all like wrong? Or should I be doing exercises for carpal tunnel, or is it more commonly neuroplastic? And I guess I'm just wondering if you have thoughts on, is your first thought likely neuroplastic, or are there times where you're thinking more structural?
I'm always thinking, when I have a new patient, I'm always thinking of all of the possibilities at the same time. And I like to share that with the patients. If somebody's in my specialty has upper abdominal pain, for example, I'm going to say, well, it could be an ulcer, it could be a gallstone, it could be your pancreas is inflamed, it could be stress, because all four of those things can cause symptoms like yours, and they are all absolutely real symptoms, and we can't always tell them apart until we do the diagnostic tests. And then we do the diagnostic tests and we find out that nope, no gallstones, no ulcer, pancreas is fine. Let's investigate the stress in more detail. And then if the patient has stresses going on in their life at the moment, if they have personality characteristics of somebody who went through stress as a kid, if we find out that they went through one type of stress or another, pretty much anything that puts pressure on a kid, whether it's, sometimes very well intended by the parents. They want to be, kind and supportive, but there's something about the environment that puts pressure on the kid, even though nobody meant for it to. And of course, there can be people who grow up in highly toxic and dysfunctional environments as well, unlike yourself. And then I'm looking also for, are there evidences of emotional issues that have been repressed? Sometimes anger will burst out for no or little or no reason. And that can often be an indication that there's a lot of anger inside that just is only occasionally popping out. But if we can find reasons why a person might have powerful negative emotions, then very often those emotions are in there, even if the person hasn't consciously connected with them. I'm also looking for triggers. Are there people, situations, or events that are triggering of the symptoms for the person? My first book is called They Can't Find Anything Wrong, and the very first story in that book is a patient who had episodes of illness for 15 years that were all triggered by her emotionally abusive mother. But she had no idea that the mom was having this triggering effect. It was only when she told me the full story that the connection became obvious. And she was cured, very quickly, even after 15 years. So it's a process that I follow that works for most of my patients. Certainly when I do the diagnostic tests and I find, there is a gallstone, there is an inflamed pancreas, then, we use the treatments for that. There are a few patients where we can't completely tell if it's neuroplastic or structural, and so it's perfectly okay to treat for both. They're not in conflict with each other. We just do the treatments for both conditions, and it usually becomes clear fairly quickly which treatment is the most effective. And I'll also mention that we have a book called A Diagnostic Guide to Psychophysiologic Disorders, which is the old term for neuroplastic conditions. And in that book is a table of 500 diagnoses that are almost 500 that are quite common in people with neuroplastic conditions. And it explains the diagnoses in plain English and explains also how commonly a neuroplastic contribution is going on, or how under what circumstances you should be looking for a neuroplastic contribution. So that's a good resource.
Great. Do you think overuse injuries are real? Is it real that you can overuse something and then just cause damage? Or do you think those are more commonly, whenever I hear someone just say, oh, overuse, I always get curious, but I'm wondering if you have thoughts on that.
Yeah, it's another one of those diagnoses that people use to fit their patient into a box of structural explanations. And overuse injury, by definition, is going to get better when you stop using it. And so if somebody's symptom is persisting in spite of their resting the affected body part, the longer that symptom persists, the more likely it is to be neuroplastic. And, certainly when we get into a length of time that we call chronic, which is, more than a couple of months, 2 or 3 months, a very large proportion of symptoms that persist for that long or longer are neuroplastic. Even if they started out being overuse. I mean, we could blame your original ankle pain on your training for the marathon, but you stop training, it's probably going to get better in a week or two at the most if it's an overuse injury. Just like your stress fracture in your shin, how long did that take to recover?
It took 4 weeks.
There you go. So things that go on for longer than that, I am increasingly suspicious about a neuroplastic cause. We have the 12-question self-assessment quiz on the symptomatic.me website that can give people some clarity about this. Good questions. Do you have any more?
I don't think so. I think that's all.
Okay. No, it's been a really good discussion. I'm so grateful for the work you're doing, bringing this information to your students, and they are going to have much more professionally satisfying careers as a result.
Thank you. Thanks for the work you're doing as well. Appreciate the opportunity to share, to learn from you. So thanks.